and thanks for joining us today. My name is Denise Berthold, and I'm a healthcare navigator with Kettering Health. Today, I'd like to talk to you about navigating your healthcare needs. I'm going to give you some practical tips on how to communicate with your provider and their staff. Let's jump in. Take charge of your health. Why is this important? Well, it's up to you to take charge. We always hear that the experts know best, but the expert about you is you. How do you take charge, you ask? Well, by effective communication with your provider, you'll be able to paint a clear picture about yourself and your healthcare needs. Let's talk about one of the very first steps many people have to take when talking to the doctor's office, making a phone call. It's important to know that the staff in the office all have different roles and responsibilities, and it's important to know what kind of question you have before selecting the option. Most of the phone options are easy, like a medication refill, canceling or scheduling an appointment. But what about the harder questions, like a medication concern, a health concern, or test results? Those are kinds of questions that you'll need to speak with the doctor's nurse. Oftentimes, the staff in the doctor's office are quite busy and sometimes aren't able to take your call. So it's important to know how to leave a voicemail. Things that you need to leave in a voicemail are like your full name, your date of birth, and a specific reason for your call. Also, a valid phone number that they can call you back. By having this information, someone can receive your message and hopefully get the answer before they call you. This will save time and effort for everyone. Once you get to the doctor's appointment, it's important to be prepared. One of the things you can do is take someone with you to your appointment. This person should be somebody who's able to listen and understand. Also, whoever it is, you should be able to speak candidly in front of. That way you don't leave any important information out. You also need to know your current medications and medical history so you can paint a clear picture for your doctor. These are things like your current medications, also include over-the-counter, herbal remedies, and any vitamins that you're taking, and your medical history, like your conditions, any previous surgeries or procedures. Go ahead and write your questions down before you go. That way you don't forget them. It's easy to forget what you want to ask once the conversation gets going. If you haven't been to the doctor in a long time, or you have a lot of health concerns, try to determine your chief health concern. This is your number one priority to talk to your doctor about. Once you've determined your chief health concern, make sure that you are able to describe your symptoms, frequency, duration of the symptoms, and any relief measures taken. This way you can paint a clear picture for your doctor so they can help narrow down the causes. If this is an ongoing issue, keep a log of each event. That way your doctor can see all of the things that have been happening over the course of several weeks. Remember, you know yourself best. If you feel that there's something isn't right, make sure you let your doctor know that concern. As your appointment comes to a close, it's important to not leave until you understand the next step. Recap the appointment with your doctor. Did they add or change any medications? Did they order any blood work or testing? Try to get any testing or follow-up appointments scheduled before you leave. That way you don't forget. If you're expecting any test results, make sure you know how you'll receive them. It's common for a nurse from the doctor's office to call you if your results are abnormal, but should you be expecting a phone call at all? Test results are also available via MyChart, which is an electronic medical record. Remember, when MyChart results pop up, they pop up simultaneously at the doctor's office, so oftentimes they haven't had a chance to review your results. If you see something in your MyChart that's concerning or you have questions, call your doctor's office and speak with the nurse. Speaking of online medical record, what is that? Kettering Health uses a system called MyChart. This is a way that you can access your medical record electronically. If your doctor is a part of the Kettering Health Network, it's likely that they use MyChart. If your provider is somewhere outside of the Kettering Health Network, they may use a different electronic medical record. Ask your provider's office which medical record they use so you know how to access it. My chart is really effective. You can do lots of things on it. You can cancel or schedule appointments. You can view your test results and some doctor's notes. If the online medical record is challenging or not comfortable for you, you can always ask your doctor's office to give you a printed hard copy of your records. Keep these hard copies in a file or folder. That way you can take them to other appointments for review. Your doctor may present you several treatment options or courses of action for your plan of care. How do you choose the right one for you? Use the acronym BRAIN. Think of the benefits to each option. Will they work well with your lifestyle? Is it something easy that you can do? But now think of the risks. Is there a side effect to the medication they're recommending? Could it be a financial burden? Or maybe you won't have the time? What are the alternatives to these options? Is there something that your doctor hasn't mentioned yet that you would like to discuss? What does your intuition tell you? You know yourself best, and you know what goals are achievable. Now, think about the N, which is not now, nothing, or negotiate. This means if I don't choose any of these options or do nothing, what would happen? Is there room for negotiation with any of these options? Let's go through an example to help you better understand BRAIN. You recently saw your cardiologist, and your cholesterol lab results have come back, and they're pretty abnormal. Your doctor has recommended that you start a new cholesterol medication. This medication can help lower your cholesterol, and they discussed with you that keeping a high cholesterol could increase your chance of stroke and heart attack. You're just not sure that you want to start a new medication, though. So what do? Benefits. Well, what are the benefits to starting this medication? The obvious one is lowering your cholesterol. But what are the risks to this medication? It's common that some cholesterol medications can cause your liver enzymes to elevate, which means decrease your liver function, or cause muscle aches and pains. What are the alternatives to cholesterol medication? You could change your diet and exercise regularly. But what does your intuition tell you? Perhaps you're willing to change your diet, but you don't have time to exercise adequately. And what happens if you do nothing, or put it off, or negotiate these terms? The longer your cholesterol remains elevated, the higher risk you are for a heart attack or stroke. And you don't want to increase your risk for either of those things happening. So you decide to go ahead and start this cholesterol medication, as you know it'll work well with your lifestyle, and you're willing to take the risks of possibly some muscle aches and pains. This was quite a bit of information, but I hope that you were able to learn something new today. If you're still confused or overwhelmed about communicating with your provider or have additional questions, consider using our Healthcare Navigator services. We're a free, confidential, and customized service through Kettering Health that can help you find a physician, connect to resources, and navigate the healthcare system. Now get out there and make that appointment that you've been putting off for a while. You can now effectively communicate with your provider and their staff, so you'll have a great conversation and get to the bottom of your healthcare needs. Feel free to reach out to the Healthcare Navigators at Kettering Health. We're available via phone. Our phone number is 937-558-3925, or you may send us a confidential email at ketteringhealthnavigator@ketteringhealth.org. We're available Monday through Friday, 8 a.m. to 4:30 p.m. If you happen to send us a message or leave us a voicemail after hours, we will return your phone call the next day. Have a great day, guys, and thanks for watching.